Hi everyone, I'm happy to present a part of my work here today. So I'm a PhD student in a team of Bruno Segui in collaboration with Vera Pancaldi. And I'm working on melanoma, advanced melanoma, and in particular trying to somehow make some prediction for clinical response to immunotherapy. So in the past 10 years, 15 years almost, melanoma has been treated with immunotherapy, advanced melanoma at least. And so immunotherapy will help immune cells to kill cancer cells by keeping them active, and particularly the CD8 T cells, killing the cancer cells. And for that, they were using some immunotherapy, so anti-CTLA-4, anti-PD-1, or the combination of the two, reaching progression-free survival, PFS, of at most 36% after 5 years of induction. But we have at least 42% of responders, and from the responders we have 22% of relapse within the 5 years post therapy. And at least also with immunotherapy, we have some immune-related adverse events. So I will be fast. I'm working on melanoma, advanced melanoma, and in context of immunotherapy, the treatments nowadays are B therapy, anti-PD-1, anti-CTLA-4, aiming to help immune cells killing cancer cells. So in the team, we worked on the previous result of the team for the TNF. So we showed that in combination with the standard immunotherapy, anti-PD-1, in combination of the anti-TNF, we would reach a better overall survival in the mice, preclinical data. So we would increase in mice the OS by 50%. And also the anti-TNF treatment would lead to an increased level of CD8 T cells inside the tumor microenvironment. For this presentation, I will talk about a piece of my data. So tumor biopsies, bulk RNA-seq. The first part would be preclinical data, so BLAC6 mice. Two conditions, wild-type mice and TNF knockout mice. So we injected melanoma cells into mice without treatment. So we have two groups, wild-type and TNF knockout without treatment. So without treatment would be PBS. And also with combination of anti-PD-1. So we have 4 groups of mice treated at day 6, and at day 10 we would retrieve the tumor and perform bulk RNA-seq. And in the other hand, I retrieved some retrospective clinical trials in human for anti-PD-1 monotherapy. So 4 cohorts, the JIT cohort, RIAS cohort, LEU and HUGO, with the different effectives in responders and non-responders. So for this work, I somehow inferred some data from the expression data. So bulk RNA-seq would give you the gene expression for all the genes in all the mice. And with that, you can infer some new data. So Nathaniel would work on metabolites, so with COMPASS, inferring all the reactions and all the metabolites. And for myself, I would work on TF activities. So the idea is to use Viper. It's a package. We would use the gene expression data along with networks of regulants. So you have TFs that will regulate some genes. They are linked with activation or inhibition, and you use this network to infer some activities. So you go from 20,000 genes to 350 TFs. And on the other side, you will use deconvolution which is cell type proportion inference. So you use also gene expression data, so RNA-seq, and along with cell type gene signatures, you could infer cell type proportions. So you could reach to a proportion of CD8, CD4 T cells inside the tumor, the biopsies. So for the mouse data, first piece of work is the PCA on the top 1,000 genes. So here you have 60% of variance explained on the first axis. So the distance between 2 points on the x-axis would be more meaningful than in the y-axis. So you can see that you have the wild-type group in the bottom right. If you put a nice circle around it, then you have the anti-PD-1 treated mice, bottom left, and then you have a mix of TNF knockout plus anti-PD-1 or TNF knockout without treatment on the top. So with that, I tried to infer some TF activities, and especially I was aiming at looking at the difference between the TNF knockout mice compared to the wild-type mice, and see if I could have a nice separation across the conditions. And so here I only present the TFs that are differentially activated between TNF knockout and wild-type. So here at the top you have 3 annotations. The condition would represent the group of the treatment. Then you have the tumor weight at resection. We are missing 3 mice for that data, represented by a cross. And then you have the deconvolved cancer cell proportion. So here you have the estimation with deconvolution of the cancer cell proportion. And you can see that we can have a correlation across the 2 factors that are, this is quite nice, I would say. So doing k-mean clustering on the TF activities, we could see 3 groups. The first one here on the left is mostly wild-type group with 4 mice in other conditions. Then you have a second group, intermediate activities, you can see, and we have intermediate weights of tumor. And then on the right, we have distinct the opposite TF activities from here to here, group 1 versus group 3. And we have the lowest deconvolved cancer cell proportion and also tumor weight at resection. So what we can see from here is that we have heterogeneity across groups, and it doesn't matter the treatment of the group. You have really 2 mice for the 3 other groups here, and other here and here. So really heterogeneous data. Then I looked at some immune scores. So here I retrieved from the literature some papers creating the scores based on gene expression. So for example, you have the cytotoxic score here, composed of the mean of expression of CD8 alpha gene and CD8 beta gene. So only 2 genes in that score, but you have also all the scores. And what we can see is that the first group with high tumor weights have also the lowest immune scores. Then you have the intermediate scores, and then the right one would be the highest immune scores. And then for deconvolutions, for especially CD8 T cells, we have on the left low infiltrated biopsies. So that would be cold tumors, so low immune scores, low infiltration, and somehow low activities for some specific TFs. Then we have a second group showing intermediate immune scores, intermediate infiltration of CD8 T cells, and also intermediate tumor weights. And then the third group on the right would be hot tumors, meaning high infiltration of CD8 T cells, lowest cancer cell proportion, and also really specific markers of activities. So for the records, for some specific markers, we have higher expression and activities also. For markers as TBX21, IRF8, state 4, and also TCS7, comparing the cold, the hot tumors, so the right cluster, and the left cluster. And also comparing with the intermediate one, we have really high differences across the three groups for these expression and activities. So for the mouse data, we see no particular synergy for the TNF knockout and anti-PD-1 treatment at the transcriptomic level, at least, because we saw it for the overall survival, but not at the transcription level. We have high variabilities in response across condition, showing that the TNF knockouts could have somehow same effects as anti-PD-1 treatment for some cases. We have three groups of mice showing different responses based on TF activities, immune scores, and deconvolution. And from this list of TFs, we created a TF activity-based score comparing the TNF knockout and the wild type, so showing really the effect of the loss of TNF in the response, in the anti-tumor response, called TF score. And we wanted to show it in the human data. So here I have the 238 patients from the 4 cohorts. And computing the TF score on these data, I can see that we have a higher score in responders than non-responders. So it is pre-treatment bulk RNA-seq, but the question is it predictive along other features? Because we can see here that we do not have a nice clear cut for responders and non-responders for only this feature. So the idea would be to combine immune scores, differentially activated TFs between TNF knockout and wild-type mice, and also differentially activated pathways between TNF knockout and wild-type mice as feature for BOTA. So for the people who were here earlier, we presented BOTA. So it's just an algorithm for feature selection, because otherwise I have lots of features for my patients, so I have to select. And as a training set, I would use 3 cohorts, so the GID, RIAS, and HUGO dataset. And for the test set, I will use LIU dataset, so it's a leave one out dataset method, and compute different methods of machine learning to compare and to see if we can be predictive. So first of all, for the feature selection, after the passage of the computing BOTA, it left us with 15 different features. So we used at least more than 150 features, and it leaves us with 15 features, and across them we have some TF activities that we saw earlier for the comparison of TNF knockout and wild type group. So we can see here that the TBX21 is increasing activities in responders than non-responders, but also with state 4, TCF7, and NF8TC2. So we have somehow the same features, and responders would be more hot tumors than cold, if we refer to that plot. And for preliminary results, we have run some different methods, and we can see that The better one is 0.62% of AUC with the SVC method. So it's not that good, I would say. We don't reach high performance for the prediction of a response, but not that it's the prediction of response for monotherapy. Let's not forget it's only for anti-PD-1 treatment. So we have to explore with other signatures maybe. We have other immune signatures I didn't try in the model. And also maybe doing different models for hot tumors patients and also cold tumor patients, because somehow the model is not finding the responders and non-responders, but he is finding with the features I gave him. It is finding hot tumors and cold tumors. So the question is, can we find responders in hot tumors patients? And we also aim to compare these results with our clinical trial. So we have 3 therapy, anti-PD-1, anti-CTLA-4, and anti-TNF, and other preclinical models, because what we show here also is that only bulk RNA-seq is not sufficient enough to predict the immune response. And we have to combine all the features. And clinical features are really crucial to be modeled in machine learning. Thank you for your attention.